Welcome to the State of Health. I'm Dr. Rahul Gupta, the State Health Officer and Commissioner of the West Virginia Bureau for Public Health. Your host, Department of Health and Human Resources Cabinet Secretary Karen Bowling, will be back for our next show. Today, we're going to focus on the health of our state's children, from childhood immunizations to home visitation efforts. Let me start by introducing two very special guests we have. First guest is Dr. Raheel Khan. He's the president of the West Virginia chapter of the American Academy of Pediatrics and also a practicing physician, as well as the associate professor of pediatrics at West Virginia University, Charleston campus. Welcome, Dr. Khan.
Thank you.
We also have Christina Mullins. Christina is the director of the West Virginia Bureau for Public Health's Office of Maternal, Child, and Family Health. Welcome to you.
Thank you.
Well, Christina, let me start by asking you the first question.
Okay.
Let's talk about the programs that we have in your office and talk about some of those programs with special emphasis on special children and families.
Okay. Our office has 3 divisions in it, and we have one division that's responsible for our data collection and making sure that we're doing things the way that you would want us to do things, and we're accountable. But our other 2 divisions are focused on programs. We have one division for women and children, and then our division that you're especially interested in today is our division of infant, child, and adolescent health. And within that division, we have our health check program, which is responsible for making sure that children receive well child exams and regular routine health visits. We have a program for children with special health care needs. We have a program for oral health and making sure that children get sealants. We have a program for our birth to 3 services, and we also have a program for home visitation services.
Great, great. Dr. Khan, let me ask you, when you're practicing and you're seeing these children for many decades, right, practicing, what do you see the impact of these public health programs that Christina described on your practice? Are they worth it, and how important are they to you as
I think we heavily rely on these programs. As you know, West Virginia population and good number of these children, they come from indigent population, and they heavily reliant on public health system and support. So it's very important to have these programs who can provide the resources and somebody to look after them. Unfortunately, a lot of these children come from remote areas. They don't have as much good access to health care. So having these programs provides a safety network for all these children.
So one of the important things I think it's for us to emphasize is the fact that in our rural state, we have populations that often have a challenge in accessing programs.
Absolutely.
And being able to do that through this. Talk about, Christina, some of the priorities, and when we talk about childhood programs, what are some of those for your office right now?
Right now, especially since implementation of health reform, our office has become highly focused on assuring that we have quality programs available for our women and children. And one of the major issues that we've undertaken since 2009 or so is assuring that kids are getting regular developmental screening and making sure that kids are on time and ready for school, and that they're healthy and ready to learn when they get to school. So that's become a really important priority for our office over the last few years.
Sure. Now, speaking of developmental delays, we know, Dr. Khan, that when we could catch it early, then obviously we could provide interventions together as collaborators in this. And when to do that, we're able to have more kids have effective, efficient lifestyles and lives, more productive lives, more contributors to society from economic impact. Let me ask you, what is that level of developmental delays that you're seeing in your practice compared to maybe, let's say, 10 years ago? Are we seeing more, less, and why do you think that's the case?
I think we are seeing more cases, and it's partly because we are picking these kids earlier and earlier. There's more recognition of these kids. There are better tools to identify learning disabilities and developmental delays earlier. We have better resources now in the community. And that's why I think it's very important to have a medical home, have somebody who continually follows these kids. I'm having some problems in terms of when these kids go to urgent care or some place
Sure.
where they don't have, they just go for the acute care, they don't come for the regular checkups and to the pediatrician. Sometimes these things get missed. So it's very important to have a designated medical home where somebody can follow these kids on a serial basis and pick up these things. There are a lot of resources through her office and some other resources within the community to provide the help. But picking these kids up and recognizing these developmental delay early in life is extremely, extremely important. Correcting them and then making them more productive later in life is going to be the next step. But recognition is the most important key factor.
Dr. Khan, you make a very important point that when kids are ill, they do need to seek care, yet well-child exam is so critical to not just having a regular exam, but catching some of the things that parents, society, communities may not be otherwise thinking. Tell us a little bit more about the importance of that well-child exam. What is it, and why do parents and grandparents need to be aware of what that is?
I think the reason being that, as I mentioned earlier, to pick up these things which might not be picked up on just acute visit when you're just focusing on that little fever or cold or sore throat. Somebody needs to look at that child in totality. So do the very good comprehensive developmental evaluation, look at the environmental factors, look at the child overall and see if that child is growing and developing normally or not, just not focusing on that acute problem. And that is the reason the importance of medical home is extremely important. Having somebody who knows that child, knows their family, and follow that child on a serial basis is extremely important.
Yeah, so medical home, getting a pediatrician that helps you understand the totality of your life and totality of your child's situation. Now, when these things or these developmental tools are implemented, Christina, and let's say the child is picked up with a developmental delay of one kind, what are those things available and resources in your office that can help work with Dr. Khan's office or other pediatrician's office across our state to implement those?
We have a couple of programs. Our first program is our Birth to 3 program. And one of the important things to remember about Birth to 3 is anybody can make a referral to the Birth to 3 program. And once that referral's been made, the team will work with the family to assess the level of developmental delay and then put together an individualized family service plan that'll kind of give guidelines regarding the types of services that child needs and put together an individualized plan to help that child overcome those delays. The other program right now that we're promoting very heavily is our home visitation program. And that program is kind of like what it sounds like. It's about parents receiving and families receiving services in their home. So we have home visitors who actually go out on site, and the purpose of that program is to work with the family to develop a plan for improving their health, their well-being, getting them ready for school. And that program, part of its underlying purpose is to just really give them a good shot at being ready for school and being ready for adulthood.
Wow. So the Birth to 3 program, as it spells out, kids who are, from all the way from newborns to the age of 3, if those delays are identified in an office setting, then you can offer those programs to those kids. And it's ultimately, as we discussed here, so critical to that child developing into a productive adult. And then home visitation, are there some kind of criteria for the home visitation program, just in a nutshell, so people need to be aware?
Those criteria are more about being high risk. So that is defined a lot of different ways. It could be anything from perhaps income,
Sure.
Education.
Sure.
It could be also maybe a family is struggling with tobacco use or something else.
Sure.
And the eligibility for that program is very broad and very wide.